You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone. I'm Dr. Rachel Hall. I'm a holistic dentist from Brisbane, Australia, with over 30 years experience as a dentist and 20 of those years practicing holistically. I'm all about how your oral health affects your overall health and vice versa, and a big focus on the impacts of what we do in dentistry on your health and well-being, and what you can do to have a healthy mouth for a healthy life. So thank you very much for joining me on the show. If you'd like to know more, you can always hop on over to holisticdentistry.au. But for now, let's get in the zone. Today, I want to talk to you about some of the research studies and the science behind how we know that dental amalgams are leaking mercury from the filling and into your body, and what the potential problems and health effects are from that mercury vapor that escapes from your amalgam fillings. Now, if you're a regular listener to the show, you'll know all about dental amalgam, but for those of you who are new and this is the first time you've tuned in, dental amalgam is a mixture of silver, copper, tin and zinc and 50% mercury. Now, when you look in your teeth, that'll be the shiny metal fillings or the ones that look black. They contain mercury. And the dental profession taught me and all the other dentists and tells you that once you mix that together, it is now somehow perfectly safe, despite mercury being one of the most toxic materials known to man. So this may be a little bit dry. So I'm giving you my disclaimer first up, but I think it's really important to establish how we know the potential health problems that you can have are actually being caused by mercury fillings and the vapor that escapes from them. Now, it has been conclusively proven and documented that the mercury in those fillings is not locked into the dental amalgam. And because of that, researchers began to trace its body accumulation and the effects that it has on the body. Now, since the dental profession and the dental community basically avoid this subject, it has been medical scientists that have joined a few interested dentists in conducting these investigations. So basically, it's now no longer being looked at by the dental profession, although I think that will come back full circle, and it's gone more into the hands of medical and scientific communities. Now, a lot of these studies were done in the 1990s, and here we are in 2023, still not paying attention to these studies and still sticking to the old dogma that these fillings are perfectly fine. When I say we, I mean the dental profession and not holistic dentists or those who are a little bit more open to going, hang on a minute, mercury's toxic, what are we doing? So there was a research team at the University of Calgary Medical School, and they published 2 animal studies that they did on sheep. And they traced the dental amalgam mercury from the fillings that they put in the sheep's teeth into the tissues of the body. And they later did a study of the dental mercury and what happened in pregnant ewes to their unborn lambs. And the team included medical doctors, PhD medical scientists and a dentist, just to give you some background. They utilised what we call radioactively labelled mercury to make sure that this mercury wasn't going to be mistaken or mixed up with or touted as coming from other sources like the water supply, feed, air pollution. And the amalgam fillings were placed in the chewing surfaces of the back molar teeth, and then they traced where the mercury went in the body tissues. And the second study was done, same technique, on the pregnant sheep. Now, within 2 days, the mercury from the amalgams, this is the radioactive stuff, was found in the maternal blood, the amniotic fluid, and the fetal blood. So that means it's in the mother, it's in the placenta, it's in the fluid around the developing baby, and it's in the fetus itself. Now, 16 days after the amalgam's placed, the accumulation of mercury were found in all tissues in the mothers and the babies. And in the unborn babies, the highest levels of mercury were in the liver and the pituitary gland. And these tissue mercury levels continued to increase throughout the course of the investigation and studies. And they found that mercury levels in your blood and your urine did not correlate and were not predictive to the amount of mercury found in your body. So this says that blood and urine tests that test for mercury are highly inaccurate and are under evaluating the amount of body burden of mercury. Now, although these dental mercury studies were attacked and derided by the dental establishment, they were quickly confirmed by other medical scientists using different research protocols. So there was a team in Denmark where they did fillings in monkeys, and the amalgam was put in their teeth. And then in 3 other monkeys, they actually just put it in the jawbone. There were 3 untreated monkeys, and they were the control group. Now, after a year, it was found that the amalgam fillings caused deposition of mercury in the spinal ganglia, that's like groups of nerves in the spine, the pituitary gland, the adrenal gland, the medulla, which is part of your brain, liver, kidneys, lungs, and the lymphatic glands, which are part of the drainage system of your gut. Now, in the monkeys that had no amalgam in their teeth, but it was implanted into their jawbones, the mercury was found in the same organs, but not so the lungs, liver, and the lymph glands of the intestine. And the organs of the monkeys with no fillings, the control group, no mercury. The research on the sheep dental mercury amalgam, this was also verified by doing these monkey experiments. So you can say, oh, well, sheep don't chew like human beings. Sheep aren't relevant, different kind of species. Monkeys pretty close to humans if you believe in that we evolved from apes. And so this monkey research is considered to be more closely parallel to what you'd expect in humans. And I know it seems pretty cruel that they're doing these experiments on animals, but this is going back 30 years ago, around the time I graduated dentistry, and things were a little bit different ethical-wise then. Now, the amalgam fillings containing radioactive label mercury were placed in the animal's teeth, and they used a whole body tracer to do images 28 days after their placement. And again, this reveals similar mercury distribution in the sheep and the monkeys. The highest levels of mercury were located in the kidney, the gastrointestinal tract, and the jaw. The fetal distribution findings of the Calgary group were also confirmed by a Japanese research group using rats as their study animals. And they found that the mercury concentration in the fetal tissues tended to increase with the number of amalgam fillings in the mother rats. So the more fillings the mother rats had, the more mercury the unborn fetus had. Now, there was more data regarding the fetal effects of dental mercury, and that was presented to the Society of Toxicology. And in one study that was done in Sweden on pregnant monkeys, where they were exposed to mercury vapor, they ended up with early abortion, premature birth, low birth weight, and a perinatal death. If that doesn't give you some warning bells, I don't know what does. But of great significance in this study is that the neonatal exposure levels closely parallel the average intraoral, so in the mouth, mercury vapor readings obtained in human beings. So we're saying that levels that cause these issues in the pregnant monkeys were very similar to the average readings of human beings who have amalgam fillings. I will let you join the dots there. In another study done in Sweden, pregnant rats were exposed to mercury during the gestation, and the offspring, they had deviations in their normal behavior when compared to control groups that didn't have pregnant rat mothers that were exposed to mercury. Numerous studies have established that prenatal exposure to mercury has adverse effects on the central nervous system, and there's been no toxic threshold established, which means there isn't amounts that are safe. Another study that was presented at the Society of Toxicology demonstrated that dental assistants who have occupational exposure to mercury experience reduced fertility. What they did was they took a group of dental assistants who worked with amalgam to those not working with amalgam. They looked at the work practices and the office characteristics that are known to elevate levels of mercury vapor. So basically the way they're handling the amalgam, and they scaled this to give what they called a mercury hygiene number or scale. Women who prepared 30 or more amalgams per week and had 3 or more poor mercury hygiene factors had a probability of conceiving in any given menstrual cycle of 50% of that of unexposed women. So just to make that really simple, because I am reading from some notes here so that I'm giving you the correct facts. The dental assistants who were mixing 30 or more amalgams and had poor mercury hygiene had a 50% less chance of conception. Their fertility dropped by 50%. And this is common medical and scientific knowledge. They know, based on occupational exposures, there is harm to those who are handling mercury. And it is a very well-known fact that mercury can affect kidney function. What was not known or previously demonstrated was whether mercury from the actual dental amalgam fillings themselves affect kidney function. And again, the Calgary group produced very dynamic information that confirmed that yes, mercury from dental amalgam seriously damaged the kidneys of animals when used in their studies. Within 30 days after placement of the fillings in the adult sheep, there was a 50% impairment of kidney function. And 2 months after, that had risen to a 60% impairment, which meant only 40% of their kidney function was normal. There's been numerous other studies as well, and let's look at what they showed. There's a study that assessed the effect of swallowed or inhaled dental mercury on the normal microflora, so that's all the bacteria and organisms that live within the mouth. And what they found, both within the mouth and the intestines, was that after 10 days of placing mercury-containing fillings in the teeth of the animals that they were using, there was a large percentage of the normal oral and intestinal, your gut bacteria, had become mercury resistant. So what? You say, well, when bacteria become mercury resistant, they cause the conversion of the different forms of mercury into elemental mercury vapor, which then gets recycled back into your body. It can't be excreted. It gets pushed back into your body. And also, what happens is mercury-resistant bacteria are also resistant to antibiotics. Antibiotic resistance is a growing problem, and it means that the medical profession are struggling to treat bacterial infections. Could it be that antibiotic-resistant bacteria exist because people are mercury toxic and those bacteria are also mercury resistant? The results of these studies do bring into question the conclusions that the dental associations come to that dental amalgam is safe. When there's these studies showing that mercury is transmitted and stored within the body and it's causing damage, how can we say it's safe? Medical scientists have continued publishing studies. They have investigated the potential for mercury to cause Alzheimer's-like damage to the nerve tissue of the brain. And these studies had been stimulated by the findings of autopsy showing high levels of mercury in the brain tissue of Alzheimer's victims. The mercury inhibits the formation of a brain protein called tubulin, and this prevents the normal structural formation of the nerves. And this results in what they call neurofibrillary tangles, and these are found predominantly and prevalently in the brains of people with Alzheimer's disease. They found that the administration of mercury in the drinking water caused Alzheimer's type damage to the brains of rats. The levels of mercury found in the rat brains were similar to those found in the brains of the monkeys that had been provided with dental fillings. A study in neurotoxicology, scientists utilizing mercury vapor, which is the primary type of exposure from dental amalgam fillings, demonstrated more damaging results than previous studies had come to. It is well known that the mercury vapor is continuously released from silver amalgam fillings and is absorbed into the brain. Rats were exposed to mercury vapor 4 hours a day for different lengths of days, so some no days, some as little as 2, and some up to 28, at 250 or to 300 micrograms of mercury per cubic meter of air, which are concentrations that are present in the mouth air of humans with amalgam fillings. The average rat brain mercury concentrations increase significantly with duration of mercury vapor exposure. So the longer you are exposed to mercury vapor, the more it gets concentrated in your brain. By the 14th day of mercury vapor exposure, the researchers were able to determine that the tubulin damage, the tubulin production, had decreased but anywhere between 41 to 74%. This caused identical brain lesions, similar or greater in magnitude, that is evident in Alzheimer's brain sections from approximately 80% of patients when compared to human age-matched controls, as in people who didn't have Alzheimer's and they've done a biopsy on their brain after death and didn't have amalgam. The authors concluded in their study that the rate of tubulin damage and chronic inhalation of low-level mercury vapor will cause damage to the brain that is essential for the formation of microtubules and therefore is most probably linked to Alzheimer's. These scientists investigated the effect of low-level exposure to mercury on the brain nerve structure. The major exposure to mercury from dental amalgam fillings is the vapor from the mercury. The Alzheimer's type damage was found to be even more pronounced from vapor than it was from having mercury in drinking water. This scientific research does seem to connect mercury to Alzheimer's disease and has stimulated the dental profession to respond. And so a study was done on nuns. Yep, I know it seems very weird. I don't know why they picked that, but here you go. They studied nuns and they said there was no connection between the amount of dental amalgam and Alzheimer's disease. What they failed to explain to you was they were saying, look, the neurological findings, they had amalgam fillings in their back teeth, were done on nuns with no amalgam fillings on their remaining back teeth. What they didn't tell you is that the control nuns, in inverted commas, those who apparently had no amalgam fillings, didn't actually have many back teeth left. They had maybe 3 out of the 16 back teeth that they're supposed to have. And seeing as these nuns had had similar lifestyles for many years, it was likely that those who'd had their teeth extracted actually did have similar amounts of amalgam fillings as did the nuns who still had teeth. I hope that makes sense. So what they're saying is, oh, well, we've got these nuns and they've got no amalgam. And then we've got these nuns who do have amalgam, and there's no difference. Well, what they forget to tell you is they have no amalgam because the teeth that had amalgam in have been pulled out. So therefore, their exposure to mercury from amalgam was very similar. And they seem to have ignored that knowledge. They also seem to ignore the knowledge that the half time, which is the amount of time it takes for half of the mercury within your brain to be excreted, is 18 years. So if I had 20 amalgams in my back teeth and had 20 teeth extracted, it's going to take over 4 decades for the mercury in my brain to disappear naturally. And so they use this very questionable and dubious study to prove a point. Mercury levels in various brain areas were compared, as was their dental amalgam history. And they said, look, there's no significant association, and concluded that there was no relationship between dental amalgam and the levels of mercury in their brain tissue or a possible connection to Alzheimer's. There was no control group of subjects who had never had amalgam fillings, and this is critical in studies of this type. And this study was done by a dentist. Can I tell you how much neurology we studied and neuropathology? Yep, you guessed it, 0. And so if this study was so great, why did they publish it in a dental journal and not in a journal of neurology? That I can't say it today. Why did they not put it up for valid peer review? Not really a great study to be basing their facts on. There was another study done in Germany, and they evaluated the levels of mercury found in the tissues of human babies who had died prenatally or soon postnatally from what we would call sudden infant death syndrome. The levels of mercury found in the tissues of the babies significantly correlated with the number of dental amalgam fillings of the mother. The results confirmed the previous findings from the animal studies and have also been confirmed by other human autopsy studies conducted in Sweden. So basically, the more amalgam that the mother has, the more mercury there will be in the fetus and the newborn child. It has now become firmly established that mercury from dental amalgam fillings of pregnant females transfers to the tissue of unborn babies in both animal and human studies. And these studies have pushed governments to issue advisories against the use of dental amalgam fillings in females of childbearing age. Also in Germany, there was a professor who studied more than 1,000 patients for mercury, fertility problems and symptoms. Mercury was measured after giving DMPS, which is a chelating agent with a high affinity to bind mercury. And it mobilizes mercury from the tissues, particularly the kidneys, so it's excreted in the urine where it can be measured. The high mercury group had more hormonal disturbances, immune system disturbances, recurring fungal infections, hair loss and allergies. A number of different hormonal disturbances were found. The sex hormones were affected also. All of these differences were statistically significant and some very marked. Allergies and hair loss were 2 to 3 times more common in the high mercury group. And the doctors at the clinic were able to successfully treat these women's fertility problems with a combination of vitamins and minerals and safe amalgam filling removal. According to the professor, mercury exposure leads to hormone and immune disturbances that can reduce fertility. And thankfully, the German government did not ignore this research and placed restrictions on the use of amalgam fillings in pregnant women and small children. Then there came a push to say, if it's not safe for children and it's not safe for pregnant women, then it is not safe for the rest of the German and therefore the world population. Sweden also advised against the use of mercury amalgam in pregnant women, and then following suit, so did Canada, United Kingdom, France and Norway. In Sweden, they also ordered that what is their equivalent of Medicare, the National Health Service, would no longer pay for the placement of mercury fillings. And although as such, no country has officially banned the use of dental amalgam, the trend of governments is clearly to limit its usage. And as recently as a few years ago, the European Union followed suit. It has been well documented that mercury can cause a number of adverse effects on the immune function. Studies showed that the mercury and the silver derived from dental amalgam fillings can cause adverse immune and autoimmune effects in animals. They cast suspicion not only on dental amalgam, but also on the new mercury-free silver alloy called Ketac silver, by saying that maybe that also has an issue on the immune system. They studied a group of animals where they put mercury fillings into one lot and composite, which is the white tooth-coloured fillings, into the teeth of animals. The animals with the mercury fillings developed a rapid activation of the immune system with significantly increased appearance of immune complex deposits in the kidneys and the vessel walls of internal organs. And animals with composite fillings and no mercury showed no reaction. Okay, so the studies seem to say there's a bit of a correlation. But what the dental profession likes to say is, yeah, but look at our dentists. Our dentists are healthier than the general public. So mercury exposure from dental amalgam fillings can't possibly be harmful to patients. Well, I'm going to beg to differ there. Being a dentist myself, being chronically mercury exposed for the first 8 or 9 years of my career, working alongside other dentists and talking with other dentists, I don't think that statement that dentists are healthier than the general public actually holds true. A lot of my colleagues are depressed, they are tired, they suffer from fatigue, stress, anxiety, poor immune health, aches and pains in their joints, and other symptoms. I myself had brain fog, short-term memory issues, I had aches and pains in my joints, I would be tired and moody all the time, I had all hormonal issues, I had a lot of allergies, I had fluctuations in my weight, I couldn't control my body temperature or my temper a lot of the time. I couldn't add up my change in the supermarket anymore. And I used to put it down to being stressed. But I can tell you, the moment I stopped using mercury amalgam and the moment I stopped exposing myself to it during the course of my work, my symptoms started to improve, to be to the point where they are almost non-existent. And after doing a detox and chelation, I felt 50 years younger, although I was only in my 30s. So I'm going to say, I don't think that statement's really accurate, but anyway, don't just take my word for it. Here we go. Numerous published studies have contradicted this position of the dental profession that dentists are actually generally healthier than the public. Studies published by a number of scientists investigated the neurobehavioral function of dental personnel in Mexico and compared this function to the body load of mercury as determined by mercury levels in urine after using mercury chelator DMPS. The study found definitive adverse effects on neurological function that correlated to the amount of mercury found in the urine after the DMPS challenge. Neurologic damage to dentists from chronic exposure to mercury had been reported as early as 1992, and this was confirmed by another study in 1995. In 1998, a research team reported their findings of neurologic damage in dentists with mercury levels consistent with those found in the general population with amalgam fillings. These studies demonstrate that exposure to mercury causes neurological damage to dentists, and that the levels of mercury received by these dentists were pretty similar to what you have if you've got amalgam fillings in your teeth. But in spite of all these studies that I've mentioned, the dental associations still maintain there is no scientific evidence demonstrating that mercury from dental amalgam causes any health problems except in those individuals who are sensitive, as in allergic, to mercury. And while the dental profession continues to ignore the dangers of mercury, the medical profession and the scientific fraternity are becoming more aware and more concerned about the harmful effects of mercury on the environment and human health. Scientific research has already demonstrated that mercury, even in small amounts, can damage the brain, heart, lungs, liver, kidneys, thyroid gland, pituitary gland, adrenal glands, blood cells, enzymes and hormones, and suppresses the body's immune defense system. In addition, mercury has been shown to pass the placental membrane in pregnant women and cause permanent damage to the brain of the developing baby. There are numerous symptoms of mercury toxicity, and I will look at those in our next podcast. I'm sorry if you could hear pages rustling while I was talking. Like I said, I was reading from my notes to make sure I was giving you factual information. This may have been a bit dry. It may have been a bit intense with the information, but what I'm trying to convey here is that there are numerous studies spanning 3 decades that show mercury from dental amalgam leaks from the fillings, accumulates in the body tissues of the person who is breathing in the mercury vapor, causes damage to your structures and organs that I've just mentioned, and has been proven scientifically to be the case. So, where to next? What do we do if you have dental amalgam? Well, first of all, don't panic. Second of all, it is then for you to decide whether you feel that the mercury from your fillings is a significant concern or potential risk to your health and well-being. If you do feel that's the case, then I urge you to seek out the support of a holistic, SMART certified dentist. SMART stands for Safe Mercury Amalgam Removal Technique. Now, if your dentist is SMART certified, that means they are going to be following strict mercury hygiene and safety guidelines when they drill out and remove your mercury fillings to replace them with safer alternatives. If you just go and have your fillings drilled out with no safety protocol, you are going to be exposed to massive volumes of mercury vapor, high volumes of mercury particulate and dust, which you will inhale, and you will absorb directly through the membranes of your mouth. You will swallow bits of filling, and you will also inhale bits of filling as well as the mercury. The mercury dust and vapor will land on your clothes, hair, and skin, and you will be exposed to more mercury in that short amount of time than if you had not touched your fillings. It would take years and years of accumulation. So if you are considering having your amalgams replaced and you happen to live near enough to Brisbane to come and see me, then you can give my rooms a call on 07 3720 1811 or reach out info@holisticdentistry.au, and we would be more than happy to see you, have a consultation, review what's going on in your mouth, and come up with a plan of action to help you have a mercury-free mouth safely. So, next episode, I'm going to talk about the toxicity and the symptoms of mercury. But for now, thank you so much for joining me. I'm Dr. Rachel Hall, holistic dentist, and this is the Dental Zone. By all means, hop on over and check out the other podcasts at holisticdentistry.au. But for now, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.